Hello, this is Dr. Kormanik with Running Rehab, and basically here what we're going to go over is some cupping for different injuries. The injury we're going to cover here will be like runner's knee, or some people use the term chondromalacia patella or patellofemoral arthralgia, but basically it's like runner's knee. Basically it's just like irritation right around the patella. A lot of times it can happen more so on the top of the knee, but it can even go under a little bit. But it's just around the margins and the kneecap, and it hurts more to go up and down stairs and that kind of thing. And then it tends to warm up pretty good during runs, but it hurts more going downhill versus uphill, that sort of thing. But with the cupping mechanisms we're going to do, it's actually going to be really beneficial to get it loose. So one of the first things you want to do is make sure that the area is warm. So you can take like a nice warm shower, or you can put like a heating pad on the injured knee or something like that to get the knee nice and warm. You're going to want to work basically the lower quad muscles and also around the margins of the knee as well. And the cupping set that I use basically, and I'll put a link in the video, but the cupping set has like different size cups here. So there's smaller cups, medium cups, contoured cups. All right, so this is obviously very beneficial when you start to work around the knee, and this can all be done on your own. And obviously, if none of this works, then you'll want to consult with a physician to make sure you're getting everything loose properly, but diagnosed properly as well. But the first thing is, you don't want to, so when you start working with the cups, you don't want to over pressure the cup. You don't want to put too much pressure into it. It should be very tolerable, kind of a medium amount of tension, like not really like painful. The first area you want to start is above the kneecap, right? Because that lower quad tendon, which comes off the front of the hip all the way down straight through to the top of the knee, blending into the patellar tendon, that's the main muscle, the rectus femoris. That's the main muscle that presses the patella into the socket. So basically, when you're dealing with runner's knee and you start to move, you start to think about it, what really all is happening is that the patella is being jammed into the femur. So it doesn't track or glide as well, and it's being jammed into the socket. So the first thing you have to do is just loosen up that muscle, essentially. So cups you tend to get a better release with the cupping if you move the area versus move the cup. So once you get the cup on there, you can even do some light motions like this, and you can sort of see how it gets puckered and contoured right there, which is going to be very beneficial in terms of getting that fascia loose. So again, you want to kind of hit multiple times on top of the knee here, and you don't want to keep the cups on too long, okay? 5-10 seconds max kind of thing, couple different movements, and then you're going to get a good release. And you can see I'm already starting to get some good reddening. So beautiful. So a good hearty quad that's dealt with some miles with running, this is going to definitely pop up real quick. Going to even work up the quad a little bit more, and then just do some simple little motions like that. Easy enough. When you start to get down towards the actual patella itself, then you'll want to use a more contoured one. That way you can actually kind of sort of hug the top part of the patella, and then you can get a much tighter fit right through there. Okay, and so a lot of times you get the couple pop off when there's decent tension. Now another funny little trick you can do is actually keep applying the pressure in the gun while you're moving, just to make sure that it maintains good ample pressure, especially in areas where it's easy for it to release. Okay, so I got a huge release right there. And again, 5-10 seconds, a couple different strokes is really all you need. Now you can kind of start to get actually with the smaller ones into the actual knee itself, down through here to start working the joint capsule. And obviously these areas are a little bit more difficult to manage with the cups, but very functional as well and very beneficial to get to release. And then you can even go to the super small guy to actually get on the actual most sore spots. So again, holding dead pressure on a spot like that, you can really get that area to pop up and let go really well. You can even do some like pre-post tests, so like before you do it, like squat down, really get an assessment of how the knee's doing, and then do all the therapies, work underneath, work over, work up the quad, and then retest after. Another good move you can do is get a little bit more of the broader, bigger cups on there. and then kind of holding on them and just kind of do some gentle squatting on that, just to get that area to let go. And again, it doesn't have to be on there too long. The session really should last maybe 10 minutes. You shouldn't do much more than that. In 10 minutes of good cupping, you can get the area to let go really well, and then totally loose, and then get you back on track just fine.